My name is Decolonizing. I'm currently in Penang, Malaysia, and I go to school at RTSI and UCD Malaysia campus, and I'm currently in my final year of medical school.
Good morning from the Philippines. My name is Joyce. I'm currently a medical intern.
My name is Maria Paula Castillo, and I'm from Nicaragua, and I'm currently studying medicine in Costa Rica, and I'm in my third year of medical school.
My name is Adebisi Adeyeye, and I just graduated from medical school from College of Medicine, University of Lagos.
Hello, my name is Jeffrey Edwards, and I am a PGY1 or first year pediatrics resident located in Boston, Massachusetts, in the United States.
Yes, I've heard.
Actually, I had never heard of this term before, so I had to do some research to answer the next questions.
No, I've actually never heard of the term decolonizing global health up until this research topic.
I have heard of the term decolonizing global health. It's something that first came up during my medical school training, and definitely a term that I've heard a lot more frequently over the past few years.
And I think for me, it means to remove any kind of supremacy that is ingrained in the global health system, and that it doesn't matter where you came from or where you trained as a physician, everyone is seen as equally capable of offering the same knowledge and care.
So for me, decolonization or decolonizing means a country breaking free or becoming independent of the forces of their colonizing country.
Even power structures, equal partnerships, collaboration, mutually beneficial relationships, and it means undoing the power structures that have created these systems of oppression for centuries.
Decolonization means that we're breaking down or removing the structures that, in a way, oppress a certain group of people and, uplift or make another certain group of people look better or more than another group. So I believe that this would mean that we are removing some of those structures. We are breaking down structures that, are kind of like remnants of the colonization of African countries or other Asian countries and removing those out of global health.
And I think it means being really radical about reallocating resources to where they're most needed, elevating voices of those who are native to that location, and really making sure that everyone has an equal say and an equally beneficial seat at the table.
Reducing the influences the high income countries have on global health.
I think that we have referred to those teachings coming from the higher income countries as something that is more superior, and we tend to apply it here, even though we have to consider that there are differences in society, in people, in culture, and what else.
Also is like when we're removing all forms of supremacy from all spaces of global health, that would be what decolonization of global health is. Okay, I was really excited to read this question, and it has impacted my training in so many ways, and I did not even realize how much the impact was until we started having this conversation about this topic. I had never really thought about this in the past.
Even though I'm not from a low-income country and I exhibit privilege in that regard, I think colonization has so many negative impacts on individuals from low-income countries. I think that it reduces the ability and the agency of practitioners from low-income countries because there's this unequal power dynamic in which people feel like they have to do what the people coming from power and privilege and from these high-income settings or these wealthy institutions are saying that they need to do.
This might apply to most, if not all, medical schools in Latin America, that our education is based on how the United States or higher income countries does their training, and most of the patient care is guided with what is proved to work in these countries. But medicine is rapidly evolving, and some countries have the resources that are needed to keep up. But for instance, in Central America, we don't have these resources. We don't have the economical or technological resources to keep up to date. So we have to base our knowledge or listen to what worked in higher income countries. The problem is our populations are genetically different. We live in different environments. So we cannot base medicine on one size fits all, because what worked in another country might not work in our country.
It has impacted my training in the sense of what I was taught, how I was taught, what curriculum was used to teach. Here in my country, we still feed off of a lot of the United Kingdom, the European curriculums. That's what we use, and that's how medical education is taught here. Also, a lot of times in my education, we did a lot of comparison between how healthcare is delivered here and how healthcare is delivered elsewhere. And we're always on the side of being told we have less resources, we do not practice the correct standard of care, we do not have the best quality of healthcare, we are rated so on healthcare standards.
I think colonization has definitely impacted my medical training, because I've always grown up with the mentality that studying abroad or studying in a white man's country was better than studying in my own local country. This is because it seems that these countries are more technologically advanced. They have more exposure to resources, which would have a greater impact on my own medical training, as opposed to, studying in my country, Nigeria.
It means that funders from people who don't live in certain communities are setting the agenda for communities that they may have never even been to. And I think that it means that instead of cultivating and encouraging individuals from communities that have been denied resources for so long, we end up elevating the voices again of people that are from these well-resourced areas and well-resourced communities. And it creates a lot of harm for the trainees and for the people who are living day to day in low-income countries.
There is a kind of a docility to how healthcare is being, or how healthcare standards are being created. We wait for those in high-income countries to tell us what to do or how to approach certain things before we get things done. Okay, for example, when we had the pandemic, there were not many local therapies or local approaches to a vaccine creation, but we had to wait till the high income countries created a vaccine, and then we asked, requested for us to be given, and then that's how it has always been.
So I think medical training needs to be adapted to our environment and populations, and we need to treat patients with the resources we have and the information that is available to us.
Most of the data, most of the information, although globally acceptable, although it's the standard globally, the population that they have been basing the data or the information is from the place where the authors are from.
So a lot of times when we are taught, for example, we're taught a new topic in class and we'll be told, okay, for the incidence of this disease is 3 in 1,000 people in the United Kingdom. I'm like, okay, what's the incidence in Nigeria? And we're like, we don't have any studies yet to tell us what the incidence is or what the prevalence is of this disease is here in our country, but we'll use the UK or we'll use the one from the US for now. But that doesn't help us in any way, because we're in this country, we're practicing medicine here. It opened my eyes a lot. I got to see things from their own perspective as well, learn from them. And I think in general, I would say that my general perspective on global health partnerships is that they are necessary. We do need each other. Mutual learning from each other would be the best way to approach whatever. It won't be us breaking all sorts of communication with the high income countries. That's we in the low or middle income countries breaking also any sort of communication or working with them. It would be us working together to make things better. A lot of times during working with them, sometimes it highlighted the issues of income and resources that I do not have. For example, we had to work on some papers and I did not have institutional access to many of the journals. They all did.
During my time in Dublin, I managed to take up research for 2 years, and doing research helped open doors of opportunities for me in terms of networking and building skills I needed for my career as a future healthcare professional. It also helped me to build valuable professional relationships with my research partners. During this experience, I realized that it is possible to build fruitful partnerships with individuals from the higher income countries. I believe that the expertise, knowledge, and resources from higher income countries are helpful in terms of improving global health. I also believe that both higher and lower income countries could work together to improve global health without exploiting the manpower of lower income countries or underestimating what they could bring to the table to improve global health.
So from where I'm standing, being Nicaraguan, I think that decolonized global health for us and most of Central America will look like treating patients more naturally, like the indigenous people did before the Spanish colonized our land. And in general, I believe that each country's healthcare system will be more focused on treating patients with the resources they have available. I mean that they wouldn't have to ask other countries for their resources because they are able and feel confident to treat patients.
I think it means that you would have equal global partners, that there wouldn't be this awkward power dynamic between someone coming from a high income setting and someone coming from low income setting. I think that it would mean in a sharing of ideas, ideals, values, resources. I think it would mean even exchanges of participation. So a lot of times right now, the model of global health is that people from high income settings go to places in low income settings. And I think that there should be an even exchange. And we have just as much to learn, and we being individuals from high income and highly resource settings from people from low income and low resource settings as they have to learn from us.
When it comes to decision making, although we have to admit there are people who are globally fit to give technical advices, these people should be limited to technical advices at the same time, not having to have the sole decision, the monopoly of decision of how things should be managed per country, per place.
To me, reimagining a world where decolonization of the global health sector has taken place would mean a world where there's health equity for everyone, as well as equal contribution in terms of resources and knowledge from both lower and higher income countries to global health.
Basically, I am just hoping for equality or fairness and more opportunities for the lower and middle income countries because they are the ones who are mostly affected by colonial mentality.
And it would be one in which we actively work against and acknowledge the historical wrongs um, that have been perpetuated, and that we don't deny the systems of oppression that currently exist, but we work to overcome them, and then we work to reflect on that and use that as motivation for not doing the same things and making the same mistakes that our predecessors have before.
Say that a decolonized global health will be one that lives up to its purpose. Global health is supposed to be an aspect of health or medicine that proposes equal health, equality in totality for everyone everywhere. And that would be what it is. A decolonized, there is no way we can achieve equality in healthcare delivery access to everyone everywhere without decolonization. So that would be not just by race, but supremacy also by gender, supremacy in all forms, ethnicity, and even within countries. So even within my country, for example, all forms of supremacy of one tribe or one ethnic group over the other is completely removed, and everyone everywhere can equally receive healthcare, and contribute to the global efforts to advancing healthcare.